Might have seen children with what is commonly known as braces. When teeth or jaws are not positioned well for whatever reason, a child will need the intervention of a dentist. How much might this cost you? Dr. Masikori looks into that on your health budget, plus whether your insurance covers this for you.
A child's teeth may need alignment due to various reasons.
Crowding is a big problem. And then the second biggest problem is when you have especially the upper jaw growing slightly forward, and therefore people tend to complain that their teeth generally look protruded, or they look like they show too much teeth.
According to the diagnosis by a dentist, they may either use removable or fixed orthodontic appliances, commonly known as braces or retainers. They can be metallic, colorless, or ceramic.
And then we have now the clear aligners, which are now made in the lab. They are made from something like plastic in the lab.
The removable appliances are used to correct minor problems.
Like if a child has a single tooth that has a problem, the fixed ones are the ones that are used to when the treatment is slightly complex and it will be slightly long. And most of the time you use it sometimes when you think the child will not be so cooperative with the removable one.
As with any medical care, this comes at a cost which differs, especially in private hospitals.
Between 90,000, the board recommended charges, but it can go to as high as 200,000 per jaw, depending on the complexity of the case. That excludes what we put at the end, which is called retainers, and also it excludes other costs, like you might need a surgeon to come in and do something like a tooth has been blocked out totally, so it's not come in the mouth, so you might need a surgeon to come in and open up, and then you bring the tooth in the mouth.
A child will often be under management by a dentist for about 2 to 3 years for the same cost.
The metallics are the ones that you go at 90, 100,000, you'll get the metallic braces done per jaw. Most of the time you do both jaws, so you're looking at 200,000. But as you go to the ceramic ones, some people charge up to as high as 120 per jaw. You can go up to as high as 150,000. And then we have the ceramic ones, but they are not white, they are clear. Now those ones, you are looking at about 180,000 per jaw. Now then you come to the clear removable one, which can only be used to correct some minor problems. Your lab fabricates them. Those ones, mainly it's about 300 to 350,000.
Since most insurance companies do not offer cover for braces, many parents find themselves spending out of pocket for this. The other hurdle is the availability of these services.
Most dentists have actually tried to do some training in basic orthodontics so that they're able to sort out the small problems. A canine is placed high and therefore it needs to be brought back in. Those ones dentists have trained and they're able to do. So availability is there, but mainly in private hospitals. The complex ones we send to a specialist orthodontist. Now when you send to a specialist orthodontist, there are few. There are, I think, less than 15 in the country at the moment, with most of them in Nairobi, 1 in Eldoret, 1 or 2 in Mombasa, none in the other towns.
The public health facilities still lag behind in offering this particular dental care. Many children who would benefit from correction early in life, unfortunately, grow up without it as the cost is too high for many. Dr. Masikori for your health budget, KTN News.